the diabetes, on cardiac rehabilitation, and the chronic kidney disease. So 18 months back, I got 10 of us will undergo pilot. So we put a 4 CGM patch. Okay. The first 15 days, then we had a gap of 15 days. Second month, then another third month. The starting, we did a control. We did a regular 15 minutes spikes, and also did a control A1C. The first starting was 6.5, it was not on medication. Then, we noticed what are the foods causing the spike. Then we modified the behavior. Then it came to 6.2, 6.1. Last week we did. 7 of us continued. It became 5.7. It's not a miracle, but this once you have the data, you understand that we're able to bring a sustainable, modifiable behavior parameters. And clearly, if we see that whatever the chronic condition, and Malu talked as some of the speakers, I think the whole 60% of Indian population who are dying because of chronic conditions. We can be seeing that 20 to 30% output can be improved just simple by behavior modification. And that's very, very critical. And today we have the technology we should ensure the thrust on giving technologies for accessibility should be available for everybody. And I think we are really at the verge of getting the pivoting the digital health. And we have all the stakeholders, we have the government, we have the public health, and we have all the private health providers, administrators. We should be able to address the critical factors of accessibility and outcome. And I'm sure with this conference and also with the technical part of PwC, we should be able to now take it to the next level and do continuing actions. Thank you very much. Dr. Chandrakumar, Dr. Adrian, Dr. Pachmuthu, and all the experts and speakers. Many of my friends are here. It's happy to see them here. I want to talk on what is happening to the mothers of Tamil Nadu. See, for this, we need to identify maybe from a pool of 10 lakh antenatal mothers who become pregnant in a year. We need to identify them with the 12 criteria. And once you identify them, we need to give an installment basis based on a certain parameter. See, the first parameter is based on the receiving antenatal checkup. The second parameter may be based on the immunization. Based on this, we need to identify whether they are eligible for the installment. And once you have done it, we need to identify the source of funding. See, the source of funding, you all know, out of this 18,000, 5,000 is from Government of India in the ratio of 60-40, and remaining 13 is from the Government of Tamil Nadu. The nodal account where both Government of India and Government of Tamil Nadu puts money, and one from the Government of Treasury account where we need to move money. See, all these things should happen simultaneously, where the mother, she will give the details to the BHN and the money should come into her through DPT to an account. See, for this simple process, all these options, multiplication is possible. That too for 10 lakhs mother only if you are able to do in digital interventions. So this is what exactly we do. For every DPT, we move through a PFMS account and money is reached. In the similar way, Chandra was talking about our insurance scheme. So the small saying that only if you are able to get an NABL accreditation, you will get 10% more as a package. We could definitely bring more people into the system. The similar way, we developed this insurance, totally an IT platform, where more than 1.4 crore families are benefited and more than 1,200 hospitals are operating for more than 1,100 packages, where our pre-authorization approval and claim approval will happen within 24 hours. And our payment will happen, which is around 1,000 crores in a year, will happen within 7 days. See, all these are possible only because we move between the IT solutions, where define the packages, predetermine the conditions, verifying those eligibility factors, and putting. In this way, we can go on top many things. Another recent example is your COVID. We've given a COVID vaccination certificate using a COVID platform. In Tamil Nadu alone, we have given around 12.75 crore doses vaccine certification. Here also again, multiple beneficiary, multiple doses, different providers, single identification. In fact, this is given as a evidence, the COVID certificate across the globe. where even the developed countries still use the manual format. We could able to give this. The similar one, based on the knowledge of COVID, we are now in the process of adapting to the UN, where more than 9 lakhs children born in Tamil Nadu, from birth to 16 years, all the vaccination will be tracked and given. This is a mini intervention. Includes all big players, small players, individual doctors, labs, everything they are able to bring it. The so-called real data generation will happen. See, this is the way in which we need to take future purely based on the data-driven decision making. And for this is one part. To make it happen, we have a HIMS version 3 now. We started almost 10 years back. We are again and again developing further. This HIMS 3 will have the major portals like how your registration will happen, how
is the Honorable Minister who is going to come, and all the dignitaries on the dais and on the dais. We had a very long conference, our last till this evening. Actually speaking, Tamil Nadu is strong at healthcare. I have travelled throughout India. I have seen many private government medical colleges are in Tamil Nadu. For each district almost we have one college, at least one. Apart from that, there are private medical colleges. The more number of students are graduating from Tamil Nadu, and the quality of medicine, what they learn, I see, it is extremely good. The other states I have seen very big hospitals and the medical colleges, the infrastructure, what we have, the teaching method, what we have, is really amazing. But they will say in other states there may be a lot of adequate clinical material is available, but the same is much more available in Tamil Nadu, because due to competition, really if you speak, government colleges are equivalent to private hospitals. Even if you take Romandara, everywhere they are giving best equivalent to private hospitals. Hospitals are also private hospitals, now they are booming like anything. These people, our private hospitals also giving best to the people. That means the medical facilities are available even to a common man in Tamil Nadu. We can reach maximum within 20 minutes or 15 minutes. It is available. What we need is now digitalization. As they say, this conference is going on digitalization. Most of the hospitals are running with digitalization, but it has not reached to the public as we think. The time has come. We will reach that also. Even when the previous speaker said, Makkalai Thedi Marthuvam, so many things, even private hospitals have started doing it. And we also have Hello Dr. Sims. It will reach to your home. You can call them. The doctor will come to you and treat everyone whatever they want. First they will assess what is the problem for the patient. Then if you read, first they will assist the patient. After that, if you need to be hospitalized, then you can come to hospital. So, private and the government are complementing each other. For that, we have to salute to Tamil Nadu. Tamil Nadu is the only state is doing equivalent to private and government as complementing each other. Anyhow, we are doing good, and anything, there is no end to that. Everything has to grow, and I hope we'll continue to do that. Thank you.
Thank you, sir. Thank you for sharing your experience. Now we have our guest of honor, Madam Supriya Sahu. Morning we had a session with the Member Secretary of State Planning Commission.
Ladies and gentlemen, good evening. Thank you for giving me this opportunity, and I would like to thank CII for inviting me to this platform. Many of you would think, that government, what kind of the digital intervention? Matter of great pleasure and pride to mention that a lot of work is already happening in the government sector, not necessarily in the health sector, but in the government sector when it comes to the digital intervention. Just imagine that someone needs a psychiatric assistance, but does not want to go to a psychiatrist, or the services of these specialized psychiatry services are not available. And even if it is available, it's really expensive. In India, you can call up a particular number which is powered by AI and machine learning, based in Delhi, and based on the requirement that you have, what you share with that particular AI tool, it gives you the expert advice of a psychiatrist without having any bias of age or having any bias of which place in the country you are coming from. It's a reality. We have 4 or 5 such institutions in the private sector which are providing state-of-the-art mental health services based on AI and machine learning. And they keep getting better. So for a state like Tamil Nadu or many other states in India, let's not name them, but where because of several factors like development, urbanization, education, you have also got a high rate of suicides. And in a situation or in a country like India, where you have 0.7 psychiatrists available per 1 lakh of population, how do you actually balance the requirement and the need? So perhaps that's the time when you have to look for futuristic options to solve these problems. And it is happening very much in our country. It's nothing that we are talking will happen in the future. So that is something that I wanted to speak about. As we are talking, Government of Tamil Nadu is looking to bring in place an electronic health record for all of us, for everybody, which will also be powered. It's not only a digital tool, but it is also a futuristic tool. And under the Tamil Nadu Health Systems Reforms Project, we have already successfully completed a pilot in Krishnagiri district. And it will be possible, of course, under Aadhaar scheme of Government of India, we are also looking to create a unique health identity. But this, which has been developed in Krishnagiri, a little advanced version of that. And we hope to roll it out as soon as possible once the pilot stage is over. So I think we are moving in a direction where you will have a complete integrated approach of digital systems powered by AI and machine learning. In the morning, you just mentioned that I think my colleague Sudha was here and she was talking about the use of AI, and I can see Vijay sitting in front of me, who is a member of the health committee, the digital committee, I'm saying health, of the committee in the Forest and Climate Change Department, where we all worked together to bring a system which is based on AI to stop the death of elephants on railway track. So when you go to Coimbatore, please do visit Madurai, where from the time when it was not implemented, you had several elephants getting hit by trains. And today, you have a solution which has been implemented by us in Madurai, complete with a control room, AI-powered cameras and tools, which has enabled that in the last, I think about 9 months from November, almost going to be a year, let's say 10 months, about 1,600 elephants have crossed safely. And this is the power of technology, what you can do. I was also thinking what we can do in health department. And apart from what DPH Dr. Selvan and I mentioned, I think one area which we should definitely look at is going to be something which is very important is the medical imaging.
Data work is got, some of the private hospitals got. We can work on the PPP system. And Amarnath can be provided in the country. Like all other public data are not in Amarnath. Why can't we do this for students? We can just work for such a maybe like-minded centers can do. The intention here is, as you said, in the last minute, it should be at the cheapest possible, right, without compromising quality. And particularly on non-communicative development. I think maternity, the government is doing really economical job. We should think about. Thank you very much.
I think we are very lucky to have two from the government sector and two from the private sector sharing their thoughts. Thank you, ma'am, for coming here, sharing your insights from government perspective. Thank you, sir, Dr. Selvan, for coming over here. Thank you, sir, being here, spending time with us and sharing your thoughts. Since morning, we have had very fruitful, interacting sessions to discuss many challenges healthcare is facing right now in the country. 7 sessions, 25 plus speakers, covering major areas of digital technology, how it can transform healthcare at crucial stage. We know that at the time of independence, life expectancy at birth was less than 30. Now we have reached beyond 70 plus. But are we happy? No. If you look at the West or developed countries, we still face a lot of challenges in terms of accessibility, affordability, lack of skilled workforce, quality of care that's not standardized at all. There are so many challenges still we are facing. If you ask what the one most important bit which can change or address all these challenges together would be technology and innovation. I don't think adding more manpower, adding more funds, creating more centers are not going to solve any of this problem. I think adding more technology should add more value for solving these issues. My only request is, I think we are talking about AI, ML, all high-end technology, blockchain in healthcare. I think we have to start from basic measures. I think morning we have had a discussion. If you look at any doctor's simple drug prescription, it's still not readable. There's a high probability that the pharmacist will read it wrongly and hand over their wrong medicine to the patients. Still, those prescription which is not readable by many people can cause major harm to the patient, to many patients. I think we have to talk about simple, easy solutions which can be easily implemented, which is scalable, can prevent major issues in the healthcare organizations. I'm sure there are multiple other areas where we can focus. We know that healthcare should be delivered through empathy and ethics, and it's being powered by technology. I think that's the best thing we should all focus on. Thank you so much for coming in. Thank you for the opportunity. Thank you very much.
फोटो எடுத்துருக்கேன்